What's up, guys? I thought I would talk about prison nursing, correctional nursing in this video. I feel like prison nursing is probably one of the best kept secrets in the field of nursing, and I think it's a pretty cool gig. I've been working as a prison nurse for probably about the last like 3 to 4 months, and I've been a nurse for about 6 years now, and I've spent pretty much the last 5 or so years working in psych. So this is a bit of a change for me because I feel like for once in my nursing career, I'm kind of like a semi legitimate nurse. And I only say that because if you work psych before, you realize that like psych is not real nursing. But I feel like prison nursing is kind of real nursing to a certain degree. So hopefully by the end of this video, you're going to have like a really good feel for what a prison nurse does, what kind of a typical day looks like for prison nursing, all that. I don't have a rubric, as you can probably already tell watching this video. Like, I'm just going to shoot the shit and just try to be real as possible. And I'm going to go off on a few tangents here and there. But I think at the end of this video, be like, okay, I'm kind of well aware of what a prison nurse does. And I will also say that I work like the facility that I work in now, it's a state facility. It's low to medium security. So some of the things that you might see in a maximum security is going to be much different than what you would see in this kind of facility. So just kind of keep that in mind while you're watching this video. All right. So the place I work at, we have right around 500 female inmates, and they're relatively well behaved because it's a low to medium security facility. So they had to have good behavior before they could come to this facility. And that's not to say that they don't have severe crimes. Like, I've read through a number of the profiles of some of our offenders, and I mean, we've got like baby killers in there, we've got husband killers, we've got murderers, we've got rapists, we've got child molesters. Anything imaginable that you could think of really has happened or has been committed by one of these offenders. So I guess I'll just start with kind of like what the average day looks like. So I work a swing shift, which is 10 to 10. There's three shifts. You've got your morning shift, your swing shift, and then your night shift. Morning shift, I believe, is like 5:30 to 5:30. Swing is 10 to 10, and then night is around like 7 p.m. to 7 a.m. So really the way I look at like prison nursing, at least in the position that I'm in now, it's really just kind of like we run an urgent care clinic. It's kind of cool. Like, I've learned EKGs, blood draws, how to use like autoclaves. It's kind of fun. Do a lot of TB injections, but I get to work pretty closely with two nurse practitioners, which I think is definitely a benefit to the job because if I have questions, which I'll have like a ton of medical questions because I come from psych, so I don't really have a strong medical background, but I can just like bounce ideas off of them. Or I'm like, if I'm unsure about an assessment, I can just walk next door and the NP is right there. And yeah, so that's kind of nice. I always get to just talk with them, or if they have something cool or intriguing that's of interest, they'll be like, hey, Nick, come check this out. And I've just seen so many neat things like toenail removals. I've seen stitches put in. I've seen just, I don't know, like we had one gal that came in with a big subcutaneous cysts that our NP just kind of excised out and drained out. That was pretty neat to see. So that's, I would say, one of the benefits of prison nursing is you get to work very close with a provider. All right, so I come in at 10 o'clock, and then basically it's just like running clinic. So we have these offenders that will either show up because they submitted a request. We call them kites. So they submit like a little piece of paper. We call it a kite. I don't know why it's called a kite, but it's like got the carbon copy on it. They keep one of the slips. We give one of the slips back. We keep one of the slips, but they fill out this little request that says like, hey, I'm having a headache or a toothache or whatever. They put in a little box, and then we schedule to see them, or they self-declare an emergency. If they self-declare an emergency, that means that they're going to come up to our clinic right then and there. We're going to assess them and then maybe speak with a provider, call a provider, whatever. And so, yeah, so I arrive to work at 10 o'clock, and then I pretty much just see women who have headaches, toothaches, migraines, whatever, up until about around 4 to 5 o'clock. And then from there, we have med pass. We see about, I would say, maybe 200 to 220 offenders come up for nightly med pass. So then the med pass is pretty crazy. I actually kind of like med pass more or less. You get to see like a bunch of different faces. I get to joke with the offenders a little bit as I'm passing meds. It's kind of a fun time. And what else did I say? The med pass lasts, I mean, it's long, you guys. It's crazy. The med pass there is the longest med pass I've ever had. It lasts probably close to 2 to 2.5 hours. And then I've talked to some other travel nurses that have worked at other facilities, and they say their med passes can last like 3 to 5 hours. Like, it's just crazy. Prison med passes are the most insane med passes you will ever do. So just something to bear in mind. I like med pass, some people don't. So if you're not big into like popping pills out of little packages and giving like a bunch of different offenders medication, then probably prison nursing is not for you. So then we do med pass. Then after that, we do like a little there's like quite a bit of clerical work, I feel like, in prison nursing. Like, for instance, sometimes we'll get meds that come in these giant boxes. We have to scan them in, and then just ordering meds is kind of a pain in the butt. And then I will say there's not like a ton of documentation. Like, I'd say psych nursing can be potentially one of the worst fields for when it comes to documentation, because I remember writing like what felt like a dissertation on a patient, a psych patient, and you don't really have that in prison nursing, which I think is a huge benefit. Like, the amount of actual documentation you do is pretty minimal, and then a lot of the times the documenting that you're doing is just following like a certain protocol. So in the prison setting, for instance, we've got protocols for everything from like migraines to toothaches to edema to pretty much whatever you can think of. There's some sort of protocol that you can follow, which is nice. Kind of eliminates like you having to go through an entire assessment and be like, okay, did I forget to check a pedal pulse when they've got lower extremity edema, something like that, right? So the protocols are nice because you can follow the protocols. So I might see somebody, they come in and I'll be like, okay, they got a headache. What's the headache protocol? And I like it because after you do a protocol enough times, you just kind of remember it. And I'm thinking, okay, if I ever go back into psych, like, oh, this is nice. I've learned this in the prison setting. And yeah, so you pretty much just follow the protocol, and then you determine if they need to see a provider or if you want to have them come back for some follow-up or what have you. And I will say, like, the main things that I see, I mean, I would say like headaches are very common, and then probably toothaches are super common, STDs, UTIs, BV. I mean, all that stuff is very common. So for instance, we might have a female that comes in, she has a toothache, right? She might self-declare. Let's just say she self-declares that she has a toothache. So she'll tell her officer, hey, I need a self-declared emergency. The officer will call up to medical, and we'll say, all right, send her on up. And then we see her, and I take her vitals. I peek inside her mouth. I look at the amount of swelling, see how much pain she's in. Is it sensitive? Is it sensitive to hot and cold? And then from there, typically I'll just call her on-call dentist. He prescribes amoxicillin for 7 days, and then maybe ibuprofen and Tylenol for pain. And then we have a dentist that comes in every Monday and Wednesday, and then they will see the dentist on Monday or Wednesday and most likely have a tooth extraction. And if you've ever worked with this population before, I mean, their dental hygiene, they don't really have dental hygiene at all. So they're primarily just getting a bunch of their teeth extracted when they go to see the dentist, because they're just not restorable. They're fractured, they're decay, and they have to come out. So yeah, so it's pretty much like prison nursing is pretty much like an urgent care setting. And so our med clinic, I guess I should just kind of share with you the environment in which I work. So when I get into work, I have to go through a metal detector. They search my lunch bag. Then I go through a bunch of secure doors. I get a little radio, little like a walkie-talkie that I can use if I need to talk with like an officer, or if someone calls like first responders, medical, I can say, hey, medical's on their way. Or oftentimes they'll be like unit 3 to medical. You say go for medical, and you talk over a radio. So you go through these secure doors, and then to get to the actual clinic itself, you walk literally at the place I'm at probably about a quarter mile before you're actually at the med site clinic. So at this facility, you've got like a bunch of different units that where the females live, kind of like, I would just call them like, they almost look like a brick apartment complexes. That's where the females are housed. You walk up through a path and you eventually get to the med clinic. And then inside the med clinic, we have like a little waiting area for the offenders. Then we have a door, a secure door that we walk through, and then we just buzz the offenders back when we're ready to see them. And then Monday through Friday, we always have an officer on site, which is kind of cool. But then on the weekends, there's no officer. And I guess I'm just going to segue into talking about safety, because I think that's probably one of the things that's first and foremost on a lot of people's mind, which I probably should have talked about at the beginning of this video, but whatever. There's no rubric. So safety, I really, I don't feel that unsafe working there. There's maybe been 2 times out of the last 3 months when I felt a little on edge, and I'll talk about that in a little bit, but that's only because of this particular situation. But I don't feel like it's very unsafe. In fact, I feel like it's pretty safe, and I think the officers do a really good job there. Most of them are very respectful with the offenders. Most of the offenders are very respectful, much more, respectful than I'm used to in Psych, where people will just like freaking call you every name in the book for whatever irrational reason may be. Most of these offenders are actually fairly well behaved. I mean, you'll get a few that are just very gamey, very street thuggy, and that's just kind of the life that they live, and they're always going to give you a little bit of an attitude. But the cool thing about prison nursing is, like, if you don't want to see somebody, or if they're giving you a bad attitude and you just want to send them out, boom, they're gone just like that. Like, it is a privilege for them to be seen at the medical clinic, and it is conditional upon them having good and safe behavior. If they don't demonstrate having good and safe behavior, you can just send them out, call an officer, get them up there, whatever. So when it comes to safety, and I mean, I guess I'm a male, like I never feel physically threatened by the females at all. And sometimes you're in the room alone with them, but I feel like there's enough people nearby that they could help if they needed to. And then you have on your little radio that you could just call for an emergency. You can also press a button on that serves as a panic alarm. And it's like a man down button. So if I press this little button that's on my little square Motorola walkie-talkie, if I press that button, then it sounds an alarm and officers will rush to my location, which is really cool. And then you can also take a phone and leave it off the hook. And if you leave it off the hook for long enough, that also is another way to declare an emergency of your own. So safety wise, I feel pretty safe. And if you ever need like an officer escort, they're always willing to help you. I'm trying to think if there's been like any, okay, the dicey situations that I've had is like, we've got this all female unit, but we also have this little, they call it SEG, where the females that have brought in contraband or they're misbehaving or whatever, they're sent over there. And then we also have a little youthful offender system that's part of this segregated unit, where after they get done with this, they ship off they ship these youthful offenders off. They're all males down the block, a few blocks, to a youth offender system. And that's the only time that I felt a little nervous, I guess, was working. Like the first few rounds I did in there didn't really feel that safe, because you've got these young males that are out in this unit. Everything is just pure concrete. You've got 2 stories, right? It's concrete and steel. And it's you and like an officer. Like sometimes it's me and this like little petite officer. And then we've got like 4 or 5 males that are anywhere from the ages of like 16 to maybe 25. And they've all committed heinous acts. Like most of them are murders in there, right? And I'm just thinking, man, if these fools want to turn right now, it's me and this officer until help arrives. So I'm just thinking like, and luckily I'm like fairly athletic. Like I feel like I could probably do what I needed to stay safe. But when you go in there, like, and they're loud and rambunctious and you've got this echoing noise and some of them seem a little agitated, like that can feel a little unsafe to me. So, and really like if I was super worried about safety, I'd be like, look, can we bring in another officer as I'm doing rounds? So the reason that I was even in that segregated unit is because with this particular prison, there's also a med pass that happens in that seg unit. So you have to prepare the meds, then you go to seg, you pass them to the males, you pass them to the females. And yeah, that's why I was in there. But I guess like if I was super concerned about my safety, or I was like a female and I didn't feel safe with that officer, I'd be like, hey, can we get another officer to escort us while we're in this unit? So yeah, I feel like overall they do a very good job with keeping you safe at the prison. And then another thing I'll say, which is kind of cool about prison nursing, is I feel like most of the staff there, including the guards, kind of treat us like royalty, which is kind of cool. I'm not used to having that feeling working in other places. Like you just sort of feel like you're there, you clock in, clock out. But at the prison system especially, I feel like medical staff has this kind of elevated position, which is really nice. It's kind of cool. And then I'll say like with the females, and of course I'm just like bouncing around on tangents at this point, but with the females, one thing that I notice is they do these things like self-declared emergencies, and they'll come in for like the most minuscule thing ever. And I kid you not, like I had one gal recently come in because she had a mosquito bite on her toe. I'm not joking. She had a mosquito bite on her toe. That's why she self-declared. And technically, per the protocol for the Department of Corrections, when they come in and they self-declare, we really just have to visually observe that they're not in any acute distress, take their vitals, and then if we deem it's not a medical emergency, we can just be like, boom, peace out, you're gone. go back to your unit. All right. And then offenders, when they come to the clinic, there's a $3 charge to be seen by medical staff, which I know, like, for some of us out there that are struggling to have health insurance, you're like, sweet God, sweet mother of God, that's pretty cool. $3 to see a provider, see a nurse, that's a pretty cheap deal. If they have a medical emergency, guess how much it costs them? Only $3. Pretty damn nice, right? And then I guess I should also say that most of the offenders have to work. Like, they are required to work. If they don't work, then they can end up spending more time in prison. So it's like voluntary, but it's not really voluntary, if you follow me. And they make like something like 83 cents an hour, something like, they make pennies per hour, which I'm totally cool with, whatever, it doesn't matter. But the funny thing is, I was doing the math because I was like getting a little frustrated with how many self-declared medical emergencies we were getting. I'm like, you know what? They really need to up the cost of these self-declared medical emergencies to offset the amount of people that we're seeing that don't really have a true medical emergency. And then I did the math, and it turns out that the amount that we charge them, about $3, is about the same amount that we pay as civilians when we go on average to the emergency room. I think the cost is like $4,000 out of pocket. So if you look at how much money we make on an annual basis, the average person in America versus how much they spend, it's about the same as these offenders are spending. Now, whether or not that's fair, I don't know, but it's just kind of interesting. So yeah, most of the females will work. There's like kitchen, they get to work out, they get yard. I mean, this facility looks pretty damn nice. I'm not going to lie. Like, I think I could survive there. It looks really clean. They have like carpentry school they can go to. You can get your GED. They can work out during the day. They can just work. There's a dog program where some of the female offenders are training dogs. Like, it's pretty cool. There's a lot of stuff that I feel like is available to them if they want to take advantage of it. Now, some of the drawbacks I will say to this job are, for instance, the counting of anything. Like TB, for instance. We give a lot of TB because they have to have annual TB, right? So if they get a TB injection, anything that you use that could be a potential weapon, you have to sign out, which means if you're signing something out, it also means that there's a count. So 3 times in a 24-hour period, we're counting everything: narcotics, sharps, tools, flashlights, like all sorts of bizarre stuff that you would never use in a private setting, more or less, or like bedside nursing. So I'd say that's like a big downside to the job. Anytime you want to use anything, you're kind of having to sign it out. Another downside is we give out a ton of Suboxone, like a ton of Suboxone. I'm talking, we have, I think it's about 10% of the population is on Suboxone. So it's like 50 to 55 females on Suboxone. Suboxone comes in these little plastic strips. We have to count them, or they come in little baggies. We got to count those. We have to double verify it. We have to prepare it for the next day. So I did the math, like in a 12-hour shift, we're spending about like around an hour and a half during that 12-hour shift counting. In a full 24 hours, 3 of those hours are spent counting and preparing Suboxone or like sharps or whatever. Like, that to me is kind of crazy. And it's kind of a little ridiculous. And I think since I'm talking about that, I'm going to go off and talk about like how I'm very surprised that we give offenders Suboxone. I get it. It's supposed to be a way to kind of mitigate opioid abuse and stuff like that. But from my personal perspective, unless something is absolutely medically necessary, we should not be providing it to people who have committed crimes free of charge. Like, that to me is absolutely ludicrous. What's more ludicrous than Suboxone, though, is we have some transgender males. That is, I think that's females going to males, right? They're in the female prison system. They get free testosterone. Like, testosterone's not cheap, right? Like, I just think it is crazy that we provide testosterone to some offenders like that. It is mind-boggling to me. And I get it. Like, I get that there are some people out there who don't feel comfortable in their own skin with their own sexuality, yada, yada, yada. At the same time, you can make a very strong case for like, this person, they just don't like the way they look. Let's see, I got a crooked nose and I wish I had 6-pack abs, and it's causing me a lot of physical distress that my nose is crooked and that I don't have 6-pack abs. So can I get some rhinoplasty and some plastic surgery on my abs to get the ab implants and fix the, like where do we draw the line, right? I just feel like it has to be medically necessary. And I feel like we have brought in a lot of mental health in there and tried to make it like a medical necessity when I don't see it. So that to me is kind of irksome. Let's see, another thing that can be somewhat common is you will have over the radio, an officer might call medical first responders to unit 2. So then you bring down the whole crash cart, you bring the gurney with you, and you prepare to provide that person with life-saving treatment. And what I've seen so far in the last 3 or 4 months that I've worked there, most of the emergencies that we've had are people that are just seizing, in which case you can just give them Ativan. It pretty much stops the seizure and it's a done deal. But I feel like from a lot of the other nurses that have worked in higher security places or have worked in facilities that have offenders, but they have a very strong psych component to them, you can just get a ton of medical emergencies that are pretty severe. And females, fortunately, when they like fight, for instance, they just like scratch, maybe throw a punch or two, but usually the assaults aren't that bad. Whereas if you go work in a male prison, oftentimes they assault to kill, and you can see some pretty gruesome stuff working in those kind of prisons. I've heard stories of like people just disemboweling themselves. They're so psychotic, poking out eyes. I've heard of offenders just smashing other offenders' face in. I've heard offenders knocking other people out or hitting them so hard in the face that their eyeball pops out. Like there's been some pretty horrific stories that I've heard in higher secured facilities. So just bear that in mind, that if you do go to work in a prison setting, yes, all of that stuff is very possible. Let's see, what else is kind of weird with prison? Oh, a lot of times offenders, when they fight, they'll get sprayed with like a very strong pepper spray called OC, Olicum capsicum or something like that. It's like pepper spray on steroids. And so when they fight, they get sprayed, and then the spray just burns. I mean, I've seen women just in absolute tears. I've seen males in absolute tears because the OC is very strong. So when they get sprayed by OC, then what we typically do is we just send them to the showers. They shower for about 20 minutes, and eventually that helps kind of clear it out of the eyes. And then you have to do what are called anatomicals. Those are pretty frequent, and those can be kind of weird. An anatomical is just pretty much a visual assessment of the person for injury. So if 2 offenders get in a fight, then you're going to have 2 anatomicals for each offender. And recently, I don't know if our place switched protocol or what, but usually the females would strip down into their bra and into their underwear, which I'm like, okay, cool. You're still kind of preserving some dignity. But the last anatomical I did, the female was completely naked, and it's a little weird because she's naked, but like the physical altercation they got in was very minimal, like maybe a push or a shove or something like that. So I don't really know why they do that. I don't know what the justification is that makes sense, at least to me. So that's something else that's a little bizarre. Like you have to be comfortable just seeing the naked human body in its full figure while you're at work. So it's just, I don't know. It takes a little bit of use to get used to, because it's like it's very undignified, I feel like, for some of the offenders. And yeah, it's just a little weird. So anatomicals happen fairly frequently because offenders often get into little scuffles here and there. And then you also have to order meds, which is can be kind of like a pain in the butt, because it means you have to sort of like tally all the amount of meds that you have. And then it's pretty common to give people injections for antibiotics for STDs. Okay, and then just as far as like the common medical stuff, like lots of UTIs, because it's just a communal facility. The women tend to have poor hygiene. They tend to be underhydrated, and they just don't really take that good of care of themselves. Toothaches are very common. Migraines are very common. I feel like we have a decent amount of females that come up with like neurological complaints, like when you wake up in the middle of the night and your arm is tingly, pins and needles, stuff like that. But I would say that the severity of medical stuff that we have, at least at our facility, is really not that bad. And another reason for that is because we have an infirmary in a whole different city, where if they start to become more acutely medical or sick, then we send them to that infirmary. So that's kind of nice. Oh, and then you always have a bunch of keys on you. Like my key set is absolutely absurd. The keys, like, I don't know, there's probably 20 keys on my key set. And I feel like that's a little bit of a downside. Like nobody likes to carry keys. Also, I think like the walkie-talkie is kind of annoying, because you just have this like radio and you can always hear like what other officers are saying, like when they're communicating with each other, and that just kind of gets obnoxious. Like having the radio and just hearing that like constant background noise can be sometimes obnoxious. But yeah, I think I've covered like the main stuff with prison nursing, and it's really just kind of like an urgent care facility. Like that's the easiest way to sum up what prison nursing is, and I highly recommend it. And I forgot to mention, like, I'm making $60 an hour at this place for a travel agency. The nurses that work there at an hourly rate, they get about 45 an hour. So, and I don't really have the same benefits that they do. So I feel like I'm like ever so slightly paid a little more than them, but I certainly don't feel like I'm overpaid. I feel like it's probably fair pay at that rate. And so, yeah, I think I'm just going to end the video there. I think I've covered everything that I more or less wanted to cover. If you have questions, just leave it down below and I might respond. Thank you so much for watching. Bye-bye.